Quality Improvement, a Historical Review by Michelle Ross. Objectives: understand the history of quality management, understand 3 historical events related to quality management, and understand how quality management is applicable today. Here's a visual of the history of quality management. There are roots back to medieval times. First, you can see in the Industrial Revolution, craftsmanship and factories came into play. The manufacturers had to put out good products or they would lose customers. Then factories forced owners to have more supervision and ensure bad products did not go out. The Taylor system led to higher productivity but worse quality, so quality control departments were created. Around World War II, they tried a sampling inspection process as they could not inspect all products for safety, and then moved into the early 20th century, which focused more on processes. This is when control charts and quality tools were created. In the last few decades, they've shifted more to look at risk management and customer satisfaction and move out of just manufacturing into service, healthcare, education, and government. I would like to dive a little deeper into a few quality improvement movements from healthcare history. The first was the beginning of the importance of hand washing proposed by Ignaz Semmelweis. Ignaz was a 19th century Hungarian obstetrician, the assistant professor at Johns Hopkins School of Public Health. He was investigating why women were dying from puerperal fever, also known as childbed fever at the time. He found that women were dying at 5 times higher in the wing cared for by the doctors and medical students, which were all men, versus the midwives' clinic, which were all women. He was ruling out ideas and testing change. They tested having the women lie on their side versus back during childbirth, but that did not make any changes in the amount of deaths that were occurring. After a colleague died from the same disease after getting a needle stick, he began to realize that the doctors were doing autopsies and the midwives were not, so they were more exposed to the body. Due to this, he implemented the use of chlorine to wash hands and instruments, and after that, rates fell dramatically. Sadly, his colleagues in the medical community did not take him seriously in his efforts. They took offense to him calling them out for not appropriately caring for the patients. He later died at an early age from likely sepsis. We could not discuss history and healthcare without recognizing the efforts of our own Florence Nightingale. Florence Nightingale was a British nurse living from 1820 to 1910. During the Crimean War in 1854, she assisted in caring for around 2,000 soldiers. When she arrived with her team, she found the patients in horrifying sanitary conditions. She also noted that the soldiers were dying of disease 10 times more than from their actual battle wounds. She improved the quality of care and decreased death of the soldiers by purchasing clean linens, clothing, soaps, and eating utensils. She had nurses cooking and cleaning in sanitary conditions and called for the British government to send in the Sanitary Commission to flush out the sewers. Florence gained recognition in quality improvement. Her recognition of an issue and resolve through process and practice change was an important first step in quality improvement in nursing history. She was awarded the Order of Merit in 1907 and brought public health to national attention. The final historical figure we will review today is Ernest Codman and the end result. Ernest Codman lived from 1869 to 1940 and was from Boston, Massachusetts. He attended Harvard Medical School and graduated from Mass General in 1895. There he was the chief of the Surgical Services Department. His notion has been coined the end result. The common sense notion that every hospital should follow every patient it treats long enough to determine whether or not the treatment has been successful, and then to inquire, if not, why not, with a view of preventing similar failures in the future. His idea began with the registry of patients with bone sarcoma. The idea of registry has taken off in several countries. The idea of the end result is also a precursor to our current term of evidence-based medicine, and one that continues to grow and expand in all avenues of healthcare. In conclusion, we know that history of quality management is diverse and complex. We did not see healthcare following some of these processes officially until the 20th century. The early experts like Ignaz, Florence, and Ernest all had very meaningful and impactful early insights and contributions to quality management in healthcare. Quality management today, many processes such as hygiene, sanitary working conditions, and evidence-based practice are the cornerstone of what modern healthcare has been built on. Quality management and process improvement are evident in our daily work, and many of these resources are dedicated to overall healthcare improvement. References are listed here. If you do have any questions, my email is listed here. I would be happy to answer them. Thank you for listening to my presentation today.